Hi there, it's Jason from the Osteitis Pubis clinic. And what I wanted to talk to you about today are different stages of OP. Now, in another video series, I'll describe how you go about diagnosing and determining what stage of OP you're in. But for now, let me just describe what each stage feels like and see if you've got anything in common with those symptoms. Now, keep in mind that what I'm describing here in terms of stages, that's based on my experience of treating OP patients. They're not a set of hard and fast rules. You might experience some really, the more advanced symptoms like pain migration or pain in your pubic bone at the very first start of OP. And other people might not really ever get that pain in their pubic bone, but the adductor soreness, which is a basic symptom of stage 1, they might experience extreme versions of that in stage 3. It's really an individual experience. This is just more of an average of what I've seen in my experience and a guide that I like to give people so they can kind of have an idea of where they're at. So let's start with stage 1. So I like to describe stage 1 as early onset OP, and this is how it all begins. You're probably training, you've upped your training load, you're running, you're playing soccer, whatever it is that you're doing, and maybe not in the session, but after the session or the day after, you start to notice that dull ache in your groins or stiffness. They just don't feel right. You feel like you've worked out really hard. Now, it's nothing too serious. You'll probably stretch it out. You might get some light massage. You might foam roll it. And generally, you're fine for the next training session. The only problem is that it starts to creep into your training. You might notice that stiffness kicking in halfway through your training session. Or after the training session, it's back again. And again, you'll treat it, you'll stretch it, you'll foam roll it, and it'll feel better and you'll be able to get back to training. You're not really thinking it's too serious a problem, and you're assuming that, hey, if I just kind of leave it for a while, it'll sort itself out. Except it doesn't. And that's when it starts to progress to stage 2.